Hi, my name is Dr. Mathew Cyriac. I'm an orthopedic spine surgeon and I work at Tulane Orthopaedics. I went into medicine because even as a kid, I had a kind of curiosity about how things work. So I used to take things apart and put it back together. And, I think eventually that applies to spine surgery because spine surgery requires kind of an understanding of the three-dimensional anatomy. So being able to take apart the spine in your mind and find the problem and putting it back together is kind of important. So it's kind of naturally, I think I went into spine surgery, which I love. I treat conditions, degenerative disc disease, spinal stenosis, radiculopathy, disc herniations, and spinal deformities. I think what's important to me is that I spend time with the patient and understand what their condition is and help them pick the best treatment plan. And like I said, oftentimes surgery may not be the answer, but if that's the case, I want to help the patient pick the best non-surgical treatment plan, which, is my goal. The most rewarding part of being a spine surgeon, I think, is that I can take patients who cannot do, such as their activities, can't play golf, can't walk, go pick their grandkids up, and because of debilitating pain, and I can, offer them the right surgery and help them get back to their kind of normal activities. They can walk, they can pick their grandkids up or kids, and I want to get them back to their normal life. And that's very rewarding to see a patient after surgery tell me, I'm back to what I used to do a few weeks later. It's great. And that's, I think, the most rewarding aspect of spine surgery.